Tuesday morning.
Well, thank you very much, my brother Stephen in Bidday. Now you're in the know on how best you can navigate the rowdy roads within the country. Mr. President, there's so many potholes around the Kubiri. I've seen them personally, and I've gone straight to Nansana and under that area. If it rains, people literally have to use boats to get from one place to another. It's really, really terrible within those areas. And those are potential voters for you, Mr. President. No opposition has to swear them to look the other side. They just have to look at the potholes and the poor infrastructure within their areas. So before we, castigate the opposition, let's look at the other natural factors that are actually pulling all the opposition forces and making you lose all those votes, Mr. President. Infrastructure projects are really wanting, and yes, I'll leave it at that. Now, we do have another conversation that we are going to be taking a look at. Nurses and midwives examinations did kick off. A total of 21,197 candidates did start their examinations yesterday in 85 accredited examination centers across the country. Now, 2,911 are diploma candidates, whereas 18,286 are certificate candidates. So we would like to know, what is it like to have examinations during a time of COVID-19 when a country is grappling with 20,459 cases of the virus and 205 people have died to the SARS-CoV-2 virus? And to speak to us about this and more, we do have Juliet Nasiwa, the Principal Examinations Officer at the Uganda Nurses and Midwives Examinations Board. A very good morning.
Good morning.
Well, what does it mean to have examinations during this time of COVID-19?
Yes, examinations are mandatory because we need these health workers to come and support the healthcare system. It's a bit challenging, but we've managed. We've ensured that all standard operating procedures are followed. Before the examinations started, we as Uganda Nurses and Midwives Examinations Board visited all the schools that are having candidates to ensure that they are complying with the standard operating procedures as guided by Ministry of Health. And all the schools had hand washing facilities, temperature guns, and we were also interested in the spacing. Like if we are conducting exams, will the space be enough to ensure that there is social distancing between candidates? Usually our prescription of the distance between one candidate and another has been 1.2 meters. But this time we are advocating for 2 meters from one candidate to another. And we briefed our stakeholders who are participating in the examinations and gave them all the guidelines that they have to follow. A mask is a must. Every school has to have sanitizers. Examination rooms have to be disinfected every after session and all surfaces sanitized. As the students are entering the examination rooms, they are usually checked. By this time we are saying invigilators put on gloves because we want them healthy as well as our candidates. So they are putting on gloves and checking the students and sanitizing in between the process. And all surfaces are to be sanitized. And those ones who are sick, we've got reports that some candidates are sick in some training schools, but they are in isolation units. And we thank God that though they are sick of COVID, they are not very weak. And some are recovering. So
let me just put that on record. You're telling us that as you kick off these examinations, which started yesterday, you have some students who contracted COVID-19 and are in isolation.
Yes.
Go ahead.
Yes. But
how many are they?
You know, the number keeps on
fluctuating. Yes.
It keeps on increasing. Some are contracting today, others are contracting the other day. So we've not yet established.
But is it manageable?
It is manageable. As I was saying, yes, they have COVID, but they are in a stable condition, and some are recovering. And because of that, none of them has been denied doing their examinations.
So they'll do the examinations while in isolation?
Yes, please.
Go ahead.
And while following all the SOPs. And of course, the schools have kept them well. They're on a special diet with a lot of fruits and fluids. And we are optimistic that they will finish their examinations well after the end of the 2 weeks.
Well, of course, you told me majority of the schools were actually adhering to the SOPs, meaning there is a slight window that some schools were not actually meeting the set standards by the health ministry.
Like there was a few schools which were found with no temperature guns. Some the temperature guns were faulty, but of course we made a follow-up and these have been rectified. Others did not have adequate washing facilities, because ideally there should be a washing hand facility at every entrance or every building of hostels. But all these have been rectified now.
And we've also noticed that there's this issue of examining students for empathy. When should it be done? Should students be taught empathy on the job or while still in school? We noticed that so many of the medical workers, especially the nurses, are very rude towards patients. And that means there's lack of empathy from these, nurses or midwives. Should empathy be taught in schools or on the job already?
It is unfortunate that some nurses are not empathetic and are rude, but really being empathetic and this is part of soft skills. They are taught while in the training, and even not only in the training, soft skills, some of these should be started with while at home in families. But even when they come to the training, soft skills are really emphasized. And even during assessment, we make sure we examine, assess those soft skills. Our practicals are a kind of what we call objective structured practical examination. Like you watch a student handling a patient, and we have a checklist of where we are marking, how is she handling the patient, has she greeted, is she gentle, is she rude? All those are being scored. And they are emphasized during the training. But it's so unfortunate that when some reach the practical, the health facilities, they don't practice what they've been taught. But I'm very sure that this is being emphasized in the training.
Now, Juliet, around May this year, even before we had even thought about letting finalists go back and do their examinations, I was talking to some experts and they were telling me we need right now, as the skyrocketing numbers of COVID-19 disease takes center stage, we need to at least send these finalists back to school so that they do examinations quickly, get passed out, and they get absorbed into many of these health centers that are grappling with low staff, incapacitated in that regard to handle the many patients that are bombarding these health centers. Do you think these examinations should have been done earlier so that we should have passed out these nurses very much earlier so that they get absorbed into the health system?
We usually have our examinations in June and December. So the candidates who are doing examinations now should have done those examinations in June. But because of the pandemic and the lockdown, this was not possible. However, we thank God that it was realized that really these people are needed in service delivery.
So the question alludes to whether or not this decision was made late.
It was made late because we had already started practicing the SOPs.
I see.
Yeah, we should have continued with those SOPs, and these students should have continued with their studies. By now, we would already have an additional workforce to the health system.
Let's talk about absorption of these students who are going to be doing their examinations. Do you hope that government will be absorbing all of them into the workforce, not just doing examinations and they go back to sitting at home with their skills, yet they are needed in many of the hospitals that are struggling?
The students who are doing examinations now, some are doing their final semester examinations, and the others will finalize in March. And of course, as we are all aware, all our hospitals now are almost full of COVID patients, and the staffing is low. I'm just requesting the government that once these students have finished their examinations, passed them successfully, they should be absorbed or recruited. I call upon the public service to consider these ones and even other private health facility employers to absorb them to help fight the coronavirus.
Indeed. So as we continue with these examinations, what are some of the problems or challenges that these schools are grappling with?
The main challenge is lack of tuition fees among some students. You know, COVID-19 definitely affected almost everybody. So some of the parents have really found it very difficult to pay school fees. Actually, some students didn't report back to school.
So some students missed out.
Yes.
Go ahead.
Another challenge the schools have faced, because of the pandemic period, the lockdown was quite long. Some of our girls have conceived, have become pregnant. Others were also unable to come back to school because they've delivered or they are heavily pregnant. And that has also been a big challenge. We've lost some of our candidates. However, they still have a chance to come and complete their studies.
Even before the exercise, even when the exercise is done?
Of course, this is a semester system. When you miss or you fail, you do whatever you've missed when next offered.
So let's talk about recommendations. What do you need government to do for you on these nurses moving forward?
As I've already said, one of them I'm requesting that
besides absorption, of course,
they should be absorbed. And then they should also equip the health facilities with PPEs because the pandemic is real and people are contracting the disease very fast. So PPEs should be available in the health facilities, and they should continue sensitizing the masses, because as what is happening now during elections and whatever, it seems like some people are not aware that COVID-19 is real.
Indeed. Thank you very much, Juliet Nasiwa, the Principal Examinations Officer at the Uganda Nurses and Midwives Examinations Board. Thank you for coming through.
You're welcome.
Well, you're still watching Morning at NTV. We are going to take a short breather and return with another conversation still on COVID-19. We do have the Presidential Advisor on Epidemics and Pandemics, Dr. Monica Msensero. She's already here.